Being a Canadian native, you've seen it firsthand. You've seen
Right,
government-run health care.
I grew up under it. The federal government fully took over the Canadian healthcare system in 1984. No private coverage is allowed for anything considered medically necessary. Most things are medically necessary in healthcare. A couple of things that aren't: cosmetic surgery, if I want to make myself look younger and better, LASIK surgery for your eyes. All procedures where the prices come down, not gone up, because the government isn't involved. And so in Canada, as I say, in '84, the government took it over. I worked at the Fraser Institute, where we started a project in '88. It first came out in '93, called Waiting Your Turn, a guide to hospital waiting lists. And in 1993, the first year, the average wait time from seeing a primary care doctor to getting treatment by a specialist. As I say, you don't call up your OBGYN in Canada. You have to go to a GP, general practitioner, who then refers you if he thinks it's necessary. In 1993, that wait was 9.3 weeks, just over 2 months. Today, last year, 2019, the average wait time had increased to 20.9 weeks. That's over 5 months. And 608,000 Canadians cross the border every year and pay out of pocket for getting MRIs, PET scans, orthopedic surgeries, hip replacements, heart, valve replacements, things like that, because they feel that their health is too important to have to wait so long. Canadians have an escape valve. If we have the government to, where are we going to go? We'll have to set up my Liberty ship. So doctors like Dr. Tom Price and others will have to be practicing offshore so that we can continue to get the very best in medicine that the American people demand. America is a very wealthy country, and my mom used to say, I hope you're not becoming one of those impatient Americans, which of course I am now. But, Canadians and Brits, when the doctor says, well, I'm sorry, Ms. Pipes, but, you're not going to be able to get an appointment with, to get a colonoscopy for 8 months to a year, even though when you think of a problem, Canadians are very nice. They say, well, fine, that'll be nice. I mean, some, as I say, 608,000 cross the border. But a lot of people, they're just so polite, and they don't know anything different, because most people growing up have grown up under single payer, and it started slowly, and as I say, it finally was all in 1984.
So there are a number of proposals out there, but when we're talking, and thus far we've talked primarily about the Sanders and the Jayapal proposals.
Right.
Is that what they have in Canada, or?
That's what they have in Canada. So, as I say, there is no private coverage for anything considered medically necessary, which is the majority of things. You can get private insurance for, like if you're a Canadian, you want to come to the U.S. on vacation, you're afraid you might, if you get sick, of course the Canadian government, what they pay would not cover any of the cost here. So people get private coverage for traveling. They'll get private coverage for having a private room in a hospital, because that's not part of the system. An ambulance going to the hospital, things like that. But Bernie Sanders' plan is even more comprehensive than the Canadian plan. As I say, these over 5 weeks wait from seeing a primary care doc to treatment by a specialist. The average wait in Canada for neurosurgery is 33 weeks. We have, for every 1 million people, 16 MRI machines versus 44 in the US. But more interestingly, 24 in Lithuania. I mean, it's really ridiculous. But Bernie wants to add free eye care, free dental care, free drugs, free long-term care. So when Charles Blehaus at Mercatus says, 30 to 40 trillion over 10 years for Bernie's plan, and he had agreed that would be the price until he didn't. He changed his mind, said he didn't want to. He told Nora O'Donnell on CBS Evening News last Friday, I just don't know how much my plans are going to cost. He's kind of backed away from that. But he knows it's going to be very, very expensive. And as we just saw today, the increase in the federal deficit under Bernie's plan would go up $20 trillion over 10 years at the high end. So, if you add more things, Canada tried to bring in free drugs several years ago under a Liberal Prime Minister, and he found out that it was so expensive that they just couldn't afford to do it. So Bernie wants to make our system even more comprehensive, and no referral to a specialist. You have to have gatekeepers, because the demand for healthcare will far exceed the supply of healthcare that can be given, and that's why I think even that 30 to 40 trillion increase in federal spending over 10 years is probably on the low side.
Probably the two most prominent examples, if you will, of the Medicare for All system are Canada and UK. And there are other countries that have it. Now, as I understand it, in Canada and in the United Kingdom, you still have an out-of-pocket expense and an out-of-pocket responsibility. As well as in Denmark, Norway, and Finland, there still are some out-of-pocket expenses that you have responsibility for.
Right, exactly. And so Canada is one of 3 countries in the world that has a true single-payer healthcare system. The other 2 are Cuba and North Korea. So think about what kind of healthcare you'd get in those countries. The United Kingdom has what we call a universal coverage system. The NHS, National Health Service, started in 1971. It covers about 90% of Brits. They allow private coverage to run parallel, and about 10% of Brits, rising though, have private coverage from, and some of the companies that are in the UK are American companies, like the Blue Cross companies, and there's a British Bupa. But this is becoming more popular because just in December there were over 4 million Brits on a waiting list to get treatment, and the cancer treatment is not supposed to be delayed from seeing a general practitioner to getting treatment more than 62 days. They haven't met in the UK that standard for over 5 years. And more important, under the World Health Organization study, Brits are at the bottom of the rung in most industrialized countries in all forms of cancer survival rates 5 years out. That tells you something about life expectancy with cancer under a government, basically a government-controlled system.
You mentioned it just a few minutes ago, and it's obviously a big concern. How much is this going to cost? I mean, I've seen figures, $32 trillion over 10 years. Trillion.
Yes, trillion, not million or billion, exactly. And as I say, Charles Blehaus has costed it that, and he said that would even include if they had some reduced administrative costs and some reduced drug costs. But the total, so that would be the increase in federal spending over 10 years. But what would be the total cost of the plan? It would be somewhere $50 to $60 trillion over 10 years. And as you it won't be free. Taxes will have to go up. Sanders has said there'd have to be a new 4% income tax on anyone earning over $29,000 a year. That is very little income in this country and would hit a lot of people. There'd be a new 7.5% payroll tax. Elizabeth Warren said, well, the payroll tax is not paid by middle-class people, because remember, her plan wouldn't increase taxes on anyone in the middle class. But she doesn't realize the people that pay the employer tax are the employees, and they are, for the most part, middle class. Then there'd be a new tax on the wealthy. There would be new taxes on large financial institutions. I mean, as Blehaus said, you could, if you doubled all the corporate income taxes in this country and all the personal income taxes, it wouldn't be enough to cover this plan. So taxes would have to go up even further. And as I say, it won't be free because you're going to be facing all these taxes. And it's not free because in terms of when you are in pain and can't work, there's a cost to having your care rationed and not being able to get access to timely care.
There's a cost to you. There's also a cost to the employer. And,
right, exactly.
And it's just a domino effect.
Right, right.
Let me ask you this. One of the things that we've been working on in Congress, and I serve on the Health Subcommittee on Energy and Commerce, has been prescription drug pricing. Obviously something that's very that I have a high interest in. And one of the, we haven't, but there have been proposals by the other side, the other party, that call for price controls on prescription drugs.
Yes.
And our concern, and my concern, has been stifling innovation. Now, I started practicing pharmacy in 1980. I started when I was 10, but nevertheless.
Right, exactly. I started working on this too when I was 10, yes, yeah.
But the point is that over that period of time, I've seen nothing short of miracles through research and development. And that's phenomenal. Now, I certainly want to make clear that the pharmaceutical manufacturers need to do a better job with their pricing, but there are other things that we can do. With price controls, do you see that stifling innovation? Do you see companies not putting money into research and development?
Well, absolutely. It will totally stifle innovation. And you have to think about it. Where is most of the research and development into new drugs, biologics, biosimilars? Where is that innovation done? It's not done in Switzerland or Germany or England. All the companies, whether it's Novartis, whether it's GlaxoSmithKline, all of these companies do their R&D in this country. And there's a reason for it. If you are a country, those countries like Canada too, England, all have price controls. So you would just lose your shirt trying to develop new drugs. And as you know, most new drugs don't make it through the system. It costs about $3 billion from an idea to getting the drug, getting a drug through all the trials and getting